For the next session, we will be talking about driving impact through institutional leadership, for which we will be joined on stage by our host, promoter and director, Apex Hospitals, founder, ACE Consultants, trustee, TiE Global Board, and President TiE Rajasthan, Dr. Sheenu Jhawar. Our speakers, Country Director for India, PATH, Mr. Neeraj Jain, CEO and Trustee, Vivekananda Global University, Mr. Omkar Bagaria, Professor, Department of Pathology, Government Medical College, Chittorgarh, Dr. Atul Tiwari. When we talk about institutional leadership, it is vital for building systems that outlast individuals and moments. While vision sparks change, institutions provide continuity, credibility, and scale. Strong institutional leadership establishes clear values, robust governance, and consistent execution, creating an environment where talent can thrive and decisions are guided by purpose. Institutions anchored by principled leadership become stabilizing forces, enabling long-term growth, trust, and impact across generations. And this conversation is about to happen on stage. Ladies and gentlemen, I request all the listeners to kindly pay attention. I would also like to request our host to welcome all our speakers with a memento. I request our host to kindly present these mementos of the Rajasthan DigiFest and the 10 TiE Global Summit. Amongst many of our supporters, Vivekananda Global University is also the university partner of this event. And sir is here on stage with us. Thank you, sir, for extending. We really appreciate the support. And now to take forward the discussion on driving impact through institutional leadership, I give it over to our host.
Does that work? Hello, everyone. I promise you, in case you are sleepy, I'm not going to put you to sleep. I'm not going to spell that magic over you. We are here to listen from some amazing institutional leaders. The topic is driving impact through institutional leadership. Now, what does that have to do with us as entrepreneurs? Well, institutions have a very, very important role to play. You're not dealing with one or two people, you're dealing with numbers. And you're not dealing with numbers once in a while, you're dealing with numbers in one go. But on the other side, you're also dealing with a set of people at the back end. You're dealing with a set of protocols, policy, rules. This is just like any other business, like a family board, where there may be leaders who may be outliers in terms of innovation, disruptive thinking, how they feel the speed of change should happen and adapt to the changing world. But their boards may think differently. And I think the challenge that every such leader faces is, how do I shift from individual excellence to becoming the catalyst for excellence? Not just for my institution, but also for the impact that I create. Do you feel that you face this kind of a disruption on a daily basis? because you're the one person, but you're representing your entire institution. So my first question to you would be, as leaders in the face of challenge and complexity of the outer world and constant changes, like any business owner does, what practices do you follow to drive the impact that you feel from the heart, and how do you measure that impact? I would pose this question to all of you in the order that in which you would like to answer. But the youngest person in the room should answer first. So, Mr. Neeraj, that's you.
Don't go with my gray hair, okay? But thank you so much for having me, Ashuja, and a wonderful question. Before I sort of respond, I must tell you it's a very overwhelming feeling of constant failure, which you have to, you have to keep telling yourself, no, you've got to keep going, and there is hope, and there is a way to do this. But yeah, I think, to your specific question of how do you go about it and how do you deal with the whole situation, I think most important thing is for us to really keep in mind that we are here to build a larger impact and impact at scale. And that can only happen when you take everybody along. So how do you bring everybody along in this process? How do you think a little bit out of the box when there is disruption happening everywhere? How do you deal with that disruption in terms of reacting very quickly, responding very quickly? Decision making becomes absolutely critical. So you are constantly making decisions which is going to have repercussions. But important to course correct very fast. Important to be able to also predict. Who would have thought that helicopters would land in Venezuela and take the president away? I mean, did you ever think that would happen?
No.
Did you? No. Exactly. And I was having dinner with my children the other day, and I said they were not able to figure out what this meant. And I said, just imagine helicopters coming into Delhi, landing on at Mr. Modi's house and picking him up. I mean, think about it. Is that even a possibility? And they were aghast. Of course, Venezuela is pretty far away, so they couldn't think that far. But so the world is changing quickly. We need to, disruption is important. We've got to be able to start predicting. We've got to be able to course correct. I think those are the things that I would really think are important as we build institutions.
Thank you. I'm going to pose the same question to Omkar. But I'm going to add one thing, that when you talk to me about the practices that you follow to drive impact and how you measure that impact, I personally believe that when we take a decision on the board for driving anything, right, any practice, if we go by majority, we sort of take the averages actually take it, the genius of the decision or the outcome down. What do you feel about it? What are the things that restrict you in taking the decisions that could drive impact, and how do you deal with them when you're doing this?
So basically for us as an institution, the impact comes from the impact on the students and their grooming as a particular case. See, we are running an institution wherein the students have come to us for a very shorter time. In the higher education sector, they come for very shorter time, say 2 years or in 4 years. But whatever the impact which will be there on them, on our decisions and our policies, that will be there for their lifetime. They are not coming us to be only engineers or managers. They are coming to us for a lifelong learning. So whether the decision is by majority or the decision is by the choice for the future, keeping our ethos in mind, the impact has to be such way that it creates a long-lasting impact on those students. Just to give an example, when we tied up with TiE for this event as a university partner, the impact are various factors. People see it from a branding perspective, that we have a logo on the stage, but the actual impact for us as a university comes wherein our students are now today volunteer at here, speaking with the partners. They are participating in various competitions. Our faculty members are part of various deliberations. So that is the impact. That is a last, I'll say, lifelong impact on them, how they will behave and how they will be groomed. Because this same kind of experience for the majority of the students will not come back. So this is a long-lasting impact which has been created. And I think that when the decisions are taken into this point of view, that's create a long version. The focus is the student and how his career will be shaped across his life.
And I must really congratulate VGU because there are so many institutions in the city, but the kind of cutting edge work that you are doing in terms of the mindset shift of your entrepreneurship cell, it's absolutely amazing. You've been organizing hackathons on almost an yearly basis, and that is really good because you're not just impacting the minds of the students who are working there because they're interacting with each other, but you're bringing people from all over the country, and I think that is extremely important. The mindset change and the perspective change is extremely important to how we set the foundation for the future. Atul, you're working in a clinical area. So how do you, the same question is to you.
Yeah, so I would agree with sir first of all, and that's like a good thing that he answered before me. So like I teach in a medical college, and from a general perspective, like it is expected that by the end of 4.5 years, everybody should be a doctor. That is the only knowledge that is required. But the reality is like the technological advancement, like we have seen in last 10 years, things are like changing very fast. So everybody should have a basic knowledge about the technology also, and that is not the thing, it is not a subject as such. So as a institutional like leaders and those sort of things, one should also educate those students about these things, how these things can help them in their day-to-day life, and not just day-to-day life, in their career also. Because after like 4.5 years and 1 year of internship, they will be doctors. They will be like treating patient, but if the technological advancements are such that they are not adapted to it, then it would be a like little bit of hurdle for them to adapt to a newer technology. So personally, I would suggest, like I also do this thing, and I suggest my students and my colleagues also, like whatever the new things are there, they should start reading about it. If it interests you, you should learn about it from the very basics, and also like tell our students, like we should do it, we should learn it. And see, I have seen a couple of my students, some are sitting here in the audience area also, like they are also, even though they will be becoming a doctor, and they are here to listen these kind of things and adapt to it. So that makes a change. So the change comes from the leaders. If they are prone to like, if they are stubborn and don't want to change, like we have done our studies and we don't want to study now. So things will be imparted on the students also in the same way. But
I think I would really laud this statement, because while we talk about technology on the outside world, we talk about health tech and med tech, but we forget that the providers of the clinical services need for technology to be woven into the fabric of medical education. Would you agree with me? Yes? I think MCI needs to hear that. If the media people are here, I think that's the bite that they need to take away from this session. So thank you so much, Atul, for picking this out. And I'm so glad that we have a very disruptive and an innovative thinker like you saying that it's not just about the clinical education, but we need to have the technology-enabled education, but technology-related education also. How do we relate this to the businesses? You know, the world is changing around us. Does our induction, our own internal training program for our people who are already working with us, are they also trained on the internal ground apart from hiring newly skilled people? Because that amalgamation has to be there. So whatever is happening outside, a bit of that light has to seep inside our institutions and our organizations. You're talking about AI, which makes me skip my second question and come straight to the third. You know, there is AI everywhere, and we are talking about it here. Omkar, how can AI-enabled education model support large-scale capacity, especially when the catchment area is very large and the resource constraint is there? And no matter how much baggage of cash you're carrying, but I believe everybody says low resources, because in proportion to what you want to do and your dreams and your ambitions, I think your resources always come down, and that shows a scale of the ambition of any institution or organization.
So AI is, I'll say, it will not replace teachers. It is there to uh, amplify the processes, to reach to the masses. Uh, we all know that the online education is now part of the game, and a lot of things are being delivered through online education. But the engagement part comes through the AI. How much the student has learnt, what are his expectations, what kind of knowledge he is getting, where the evaluations can be done. All this is being done through AI. Moreover, since research is a field, and many of us know that earlier it used to take years to do a PhD, to read 100 papers. Now AI can generate and say that this is the crisp of the paper, and then you do analysis on top of that. So it is not replacing the humans as such, and I think it is more important in the pharma and the medical sector, wherein it was very difficult to do a new research. But with coming of AI, a lot of things have increased their pace, but it will never replace the humans, and it will just amplify the growth rate. Uh, with the online education, I think we will be able to reach to the masses. As you were saying, the capacity development is a challenge today. Earlier, I say there was 10 years back, there was used to be called a digital divide. We used to say that the people in the city knows the technology, and the people in the rural were not aware of these. Now the era is coming is AI divide. We have lot many people who are using AI in various forms on to day-to-day basis, and there is another part of the country where they are only hearing this word. And we as institutions, all education institutions, from the government sector as well as the private sector, has to take this as a challenge and ensure that the whole country is at the same level. Of course, every person will behave differently, but the basic knowledge of AI needs to be given at the lower level to the top institutions. And that is how I think the AI policy and impact, what the government of India is trying to do, is on the same lines. If the AI divide will be huge, then it will be a challenge for the country.
Thank you. Neeraj, I would like to pose a different question to you. You know, apart from the impact that you create, you also have the responsibility of creating a value framework, because impact has to be created within the perimeter of values. Again, there's uncertainty, there's complexity, there's the government, which is very good, of course. This is being recorded. There is, you have donors as well. So at that intersection and within the value framework, how do you create that institutional fabric that promotes this, where you don't have to do it on a day-to-day basis, but that gets embedded within the culture of what you drive through your institution?
Yeah, I think, so I work in the health sector, and, we do a lot of work across the ecosystem. So that whole idea of an ecosystem approach, firstly, has to be paramount. It is not one organization, one institution, government or private or not-for-profit or academia. It has to be all together. The government plays a very, very important role, because the government is the binding force. They are able to use the carrot and the stick. So that kind of really helps in a way to bring everybody together. But without academia, it's not going to work. Without the private sector, it's not going to work, because sustainability comes from the private sector. So, we do a lot of work on technology for public health, which is all coming from the private sector. I think if we the way we frame it is think about equity. And, Omkar said it very well, that we can't have that digital divide, we can't have the AI divide. Some people will be coding, there'll be some people who are going to be using it, but it's going to affect all of us. And if we are able to try and bring equity in this process. I think that's the direction we need to go. So if you put equity and impact right at the top and focus on those with an ecosystem which is supporting all of those, probably that's where we'll go. It will never be 100% equitable, but I think minimum level has to be achieved. And I think that is what we should be striving for, and that is what our government wants. And I'm completely with that whole thought process.
So they become sort of guardrails also.
Yes, absolutely. We're all talking about AI. It's becoming painful. AI. How many of you are tired of AI? Yeah, you see? I mean, all these people out there.
Mahavir is tired of AI, really?
There's too much AI going around. I think we need to just park it. My boss used to say, we work in the health sector, so he used to say it's not about digital, it's about health. Digital is just a means to get to health. So let's focus on that. AI is just a means, and AI will turn to blockchain, will turn to ML, we'll have new terminologies coming. Yes. But I think the focus on the impact and what are we trying to achieve, I think that needs to be, and you'll find a lot of bright, shiny objects out there. Don't get mesmerized. Look through them, see where the impact is, and you'll be fine.
Thank you. That was nice. Atul, what do you have to say to that? I know you're sitting on the edge of your seat wanting to say something.
Yeah, basically, sir has pointed out one nice thing that I wanted to extend to that. He mentioned that there will be people who are coding and there will be people who are using it. So it's the same way. In case of academia, I'm seeing most of the people or my students, at least I have seen those, they are taking answers from ChatGPT directly. So yeah, why not? But it's the thing if someone asked me who was the 5th Prime Minister of India, it's the thing that, okay, today in the scenario where I am sitting now, I don't need to remember that thing. But do I need to remember if, I'm a pathologist, if I need to remember a histopathological finding of any tumor? I do need to remember that. My neuron should remember that.
Data coming in.
Then you can't say that we should be not hearing about AI, because those things are AI only. But yeah, jokes apart. But the thing is, one should always know using these just tools and not knowing what might be their limitation is also a huge disadvantage. How can these LLMs be wrong? You might learn wrong things also, because you didn't even read textbook. Nowadays, even students ask me, do we need to buy the textbooks? And they are far more dependent upon these tools only. So it's better, if they know how these tools work, you don't need to know coding. It's at least in healthcare sector, doctors don't need to know coding. If they know, that's better, but it's not a must thing, but they should know how these things are built in a layman language and what are their limitations specifically. I'm more focused about their guardrails, their limitations. One should always know, these are the limitations, without which it is a very dangerous thing.
Absolutely. And I completely agree with you. So, universities like Omkar's, for example, you have a lot of moral responsibility in this area as well. So how do you ensure that you're socially relevant while being financially resilient, while imparting the right kind of know-how, education around all of this to your children? How do you ensure all of this? Because you have a very big responsibility really towards the future. And you also are in a position to make the right kind of policy advocacy, because you are shaping the future of the country. So how do you take this responsibility, and how do you ensure that you're relevant and resilient and all of that? I'm sure it's a big responsibility.
So, see, the education today, and of course it was never, but is not only the classroom teaching. When we talk about classroom teaching, it's coaching, right? The education is a holistic development where you will have to be socially relevant. The students need to know about the social structures, the social issues, and how to deal with them, as well as they need to have life skills. They need to have a holistic development around everything. As a policy advocacy, I'll say the one thing which we all must do, and as our part of our institution, we always do, is that the empathy is the core of everything.
Wonderful, wonderful.
So you have to be, whatever you are deciding, whatever policies you are making, of course, with the coming of the new education policy, there are a lot of flexibilities. But you can't take out empathy out of all the policies. Empathy has to be there. Of course, the times are changing, and we see that in the education sector, and specifically the government advocacy for the social issues is nowadays a lot. Government talk about SDGs, teaching environmental issues, teaching the social and cultural issues. Be you are in any profession, these are part of the overall development of any student, and this I think has to be taken. So if you feel that the empathy is part of your policy and day-to-day activities, it will go inside the student, and they will be able to take this forward.
Great. So one last question to all of you, the same question. You sit on very senior positions. Like we said, you're the face of your institution, and you're driving the impact, you're making the decision. But I'm sure in your lives, there has been that one defining moment where you probably feel that there has to be a purpose to the impact that you can make from the position at which you're placed. So we would love to know the person behind the designation and the name. Who is Omkar? What was that defining moment for him? And the same for Neeraj and Atul, and in that order, please.
So one defining moment, if I say, was during the Corona times. For us as an institution, as we all know, there was a lockdown, and we had few foreign students. They couldn't be sent back to their nation. And that was a defining moment, that was a very challenging moment, that you have to keep the campus open despite being a lockdown, and to take care of their activities. With vis that you have a lot of students across, and you have to come online, innovate, take the innovative steps, and be live. I'm very proud to say that at Vivekananda Global University, we will be able to go live classes within 72 hours. So that is the way, and I say that innovation is a risky game, but you have to take that risk to be a developed nation. If we want to be a Viksit Bharat, we will have to innovate in each and every process, systems, and probably that is the way that today the culture of the university is so innovative that we are saying that we have 130 odd startups coming up and doing a lot of activities. So that's part of our, I'll say, ethos and culture at the campus that's helping us.
So that's a perfect example of, you're not just saying, you actually practiced it and you did not even realize. And when you say that empathy is the most important value, it's absolutely evident that that drove your decision making and became the defining moment as a branding of your institution as well, and gave the right impetus for all of your people within the institution that this is what you believe in. And that's really amazing. Thank you. Neeraj.
It looks like COVID-19 was a defining moment for many of us, so including me. We work in public health, and COVID-19 was a public health crisis. We were public health warriors, so to say. Many of our team members were either falling sick, and we have a team of about 600 people across India, or their families were falling sick, etc., etc. But we had no option but to work, because we were working with the public health departments of 22 states. And I remember when the oxygen crisis hit during Delta, we were one of the only organizations that had been working on oxygen for many years. And many of our team members were falling sick. We had understudy, one understudy, second understudy in case somebody falls off the map. And I think I remember my family asking me, you work in oxygen, what's going on here? Why is there a crisis? And of course, I think, from the medical education piece, while we do teach about oxygen, but it's not as detailed as you would want it to be for a pandemic.
Crisis, yeah.
But I think all my life, and I'm 58 now, on your first point, I have never worked so hard. I think I was working 15, 16, 17 hours a day, 7 days a week, 3 months. But it really changed my perspective. I was, all of a sudden money became unimportant. You started thinking, okay, what the hell are we doing? Why is it taking so much time? Can we, become faster? I'm telling you, I came out of it with literally a fire under me that time's running out. We need to go faster. We need to, disrupt faster. We need to innovate faster. We need to do things at scale. This is not about, we are 1.4 billion people. We need to make sure that and at least half of them need help. The inequity is half of the country. So I think I'm changed. I also went and started diving after that. I got my PADI certification. I've calmed down a lot. I'm thinking a lot. So yeah, that was defining for me.
Awesome. I'm sorry it took a COVID for such defining moments to come into our lives, but well, it did, and maybe the world is going to be a better place because so many of us have changed because of what happened to humanity. Atul?
Yeah. So while COVID-19 was a defining moment for all of us, yes, for me, if I will be honest, even before becoming a medical teacher, I was a medical officer for around 10 years. And while during that time, I served in good institutions to tier 2, tier 3, and even in rural tribal villages of Pratapgarh district for my longest period of time, around 2 years. And there I realized lack of resources, how much they can be very painful for the patients and their treatment or even diagnostic part also. So in 2012, somewhere at that time, there are so many painful stories that are from my very little career. Few of them, or especially due to time constraint, I will tell one of that. There was an accident of a young female from a motorcycle. And we know that this lady required CT scan. And in Pratapgarh district, I don't even think even till today if it is there or not, but at that time it was not there. Not even a radiologist in the entire city is not there. Nearest city was Udaipur. Due to protocol, we had to shift her. But by that time, on the highway only, the patient expired. So that is the most critical thing one can think of. And being a clinical, at that time I was in clinicals, and we know that this patient doesn't have that much of time. And yes, that is painful. And can we tell the attendant that on the midway of somewhere between Pratapgarh to Udaipur, this won't survive? So these are the critical things one will have to face challenges. And that was one of the key defining area for me. If at that time no one had predicted this AI and the ChatGPT or whatever, all this boom would come. But yes, these have made so good LLMs. Radiology is one of the first branch to be affected by this AI. But that being said, it is not replacing the radiologist, but it is aiding it in such a way that now, today only in the exhibition area, I saw one or two models someone presented, one about X-ray and one was about CT scan. They were very nice. Now, they have mentioned that they have tied up with Govt of Rajasthan. And if those can be implemented in those rural areas where there are no specialists, so it would be very nice, from tier 1 cities, the radiologist or pathologist, they can easily make the diagnosis and the treatment can be started on time. So this was one of the things that I used to dream in 2012. Till that time, we didn't have this kind of terminology also LLM and all this Gen AI. But yeah, I used to think if there can be something that we can do for these rural areas where there is no doctor, there is no machines, how can we make the diagnosis, how can we start the treatment? And the 300 kilometers of the journey, every second counts. Yeah.
Thank you so much. Maybe there's a mistake. You're not even a clinician, you're a coder. Thank you very much for being here. And in fact, I would like to say that all of us are a part of the TiE Global Summit. We've created this huge, huge event. But at the same time, all of us who are here, who are part of this, come from some institution or the other. And that is the largest impact at scale that we can see. And we need to be thankful to the people behind these institutions who are churning out tomorrow as we speak. Thank you very much.
Thank you.
Thank you so much.
Thank you. Thank you, ma'am. Thank you, sir. Thanks to our host, Dr. Sheenu, for bringing out the best information from our speakers, something that our listeners have multiple takeaways from. I'd like to once again thank Mr. Neeraj Jain, Mr. Omkar Bagaria, and Dr. Atul Tiwari. This was the second last session of day 3, the final day of Rajasthan DigiFest and the 10th TiE Global Summit, where we also had our mascots Raj and Meera, the robotic avatars in Rajasthani attire, welcoming the thousands and thousands of visitors. This brings us to the final session, and the final session is on democratization of AI for innovation and inclusion. For this, I would like to invite on stage India AI CEO, Government of India, and Shri Abhishek Singh. And I would also like to invite MD South Asia, NVIDIA, Shri Vishal Dhupar. And our moderator, MD, Primus Partners, Shri Samir Jain.